Good morning and thank you for joining us for the public launch of the International Food Information Council Foundation's 2015 Food and Health Survey. I'm Matt Raymond. I'm the Senior Director of Communications here at IFIC and the IFIC Foundation. I'm joined by Marianne Smith-Edge, our Senior Vice President of Nutrition and Food Safety Communications, who will be discussing the results of the survey shortly. The International Food Information Council Foundation is dedicated to the mission of effectively communicating science-based information on health, food safety, and nutrition for the public good. The IFIC Foundation is supported primarily by the broad-based food, beverage, and agricultural industries. This is the 10th anniversary of the Food and Health Survey, and we hope that you will agree that there are several particularly interesting finds this year. Everything you see and hear today and more, including our press release, which was emailed to you a little bit earlier, the full survey and an executive summary can be found on our website at foodinsight.org. And you can look for additional assets to come, such as infographics and audio. Now I'm going to turn it over to our Senior Vice President for Nutrition and Food Safety, Marianne Smith-Edge.
Thank you, Matt, and good morning, everyone. We know Americans have a lot of priorities to juggle. Consumers want to be healthy, but life just gets in the way, balancing the desire for health-related behaviors with the demand of busy schedules of work and family. So this year's survey delves deeper into the trade-offs Americans made regarding health and nutrition on an everyday basis. Consistent with previous years, more than half of Americans rate their own health as excellent or very good. But this year we actually compared the perceived health status to weight status. And when you see this, we see that half of Americans who see themselves as excellent or very good are overweight or obese. So we see that weight status may not be related to perceived health status. However, you will note that those that are technically defined as obese are more likely to find their status as fair and poor, as well as those Americans who are currently being treated for chronic disease are also more likely to rate their health as fair or poor. We wanted to get a baseline on how much Americans really thought about the healthfulness of their food and beverages. And as in previous years, we've seen that about 91% have given at least some thought to the healthfulness of their food and beverages in the last year. So how does health compare to other priorities? This year we asked, if you were given an extra $100 every month, how would you actually spend it? And not surprisingly, 6 out of 10 Americans really prioritize financial health. They would either save it, invest it, or pay off debt. No more than 13% would actually apply this extra money to any of the food or health options. We know that Americans are thinking about their weight. And 4 out of 5 Americans are trying to lose weight or maintain their current weight. The good thing is slightly more are trying to maintain weight than not doing anything about their weight status, which is definitely a first step to taking control. We ask a question again from 2013. How does weight gain actually compare to financial loss? And even though a majority said they would rather lose $1,000 than gain 20 pounds, we see that men are actually evenly divided on the trade-off, and women would definitely rather lose the money than gain the weight, and individuals over 50 are likely to agree with that as well. So when asking consumers about what they perceive as the most successful strategies for weight management, Americans seem to understand that there is a balancing act, because more say they would likely change the type of foods they eat, as well as getting enough physical activity is also important. But whether they see it and believe it might be two different things. So even though 4 out of 5 Americans are trying to lose or maintain their weight, we ask, what are some of the barriers that might prevent you from staying on track? And not surprisingly, lack of willpower and lack of time definitely is a major barrier for a large portion of the population. So to explore the time management issue more, we asked, if you have 4 extra hours every day, what would you do? And we see that majority say they would exercise or spend time with friends and family. Only about 1 in 10 would spend any time cooking or tracking their physical activity. So it must be that physical activity is somewhat perceived as requiring extra time. So perhaps it's important that we frame physical activity as a way to actually socialize with friends and family and realize that fun stuff can count. In the previous slide, I noted that only 11% basically say they would spend more time cooking and baking, which is rather interesting considering that limited time is already spent on preparing an average meal. We see that less than 20% of Americans say they spend less than 15 minutes preparing dinner on an average weekday. Slightly over 50% spend less than 45 minutes. However, we do see that there is a cultural influence here, as more Hispanics and African Americans are likely to be in the group that say they spend more than an hour preparing a meal. So when comparing cooking time to how individuals would spend extra time, we see that those already spending more time cooking and preparing dinner are the ones who are more likely to use their extra time on food and diet-related activities. Conversely, we see that those who spend less than 15 minutes preparing a meal would more likely watch television. When it comes to comparing income and extra money, lower income consumers say they're more likely to spend extra money on groceries or dining out. So when it comes to shopping, Americans consistently list expiration date, nutrition fact panel, and ingredient list as the most frequently used information on a label. On an average, consumer reports looking at an average of 3 pieces of information when making a purchasing decision. And this is considerably less than over the past years. 4 years ago, people said they looked at 7 items. A couple years ago, 5. So to delve deeper into purchasing decisions, we ask consumers if they buy foods on a regular basis because of production methods or source. And we see this year that 4 out of 10 say they do buy foods that are advertised as natural, and about 30% basically say they buy food that's advertised as no added hormones, organic, or locally sourced. We do find that those that are more likely to buy these type of items are higher income, women, college level education, and overall deemed as better health. With processed foods being in the news, we ask a hypothetical question. If processed foods were removed, what would be the impact? And for half of Americans, they believe they would be most impacted by a higher cost of food if processed foods were actually removed from the supply. Less convenient. However, 4 out of 10 actually see that perhaps the food supply would definitely be improved health and nutrition, and those that are younger or higher education are more likely to believe that. However, when we ask about what the benefits were most valued of processed foods, we see convenience, shelf life, and affordability are top of mind. So as noted previously, convenience and price are viewed as important. But how does it stack up to taste? For 10 years, we've asked this question, is how much impact do the following have on your decision when you buy foods and beverage? And consistently, taste is king, followed by price and healthfulness that continue to drive consumers' food selections. But this year, we find that Americans feel less strongly about these 3 factors than in 2014, and healthfulness was not as high as the previous year when looking at overall food decisions. So when we're looking at consumers on what consumers are trying to consume more of or avoid the following, consistently over the years, consumers are saying they want to consume more whole grains, fiber, and protein. We also see some growth in omega-3s and potassium. And not surprisingly, consistently, consumers are saying they're trying to avoid calories, and over 50% are saying they're trying to avoid sugars in general, sodium, as well as added sugars and trans fats. So when asking about sources of calories most likely to cause weight gain, we see the sugar emphasis continues. Since 2011, more are likely to believe that calories from sugars and carbs are more likely to cause weight gain. We know that the healthfulness and food components are important to Americans, but what about the way the food is produced? We see that consistent with previous years, about 6 out of 10 of Americans have given some thought to the sustainability of how their food and beverages are produced. With the emphasis from the Dietary Guidelines for Americans in 2015 focus on sustainable diet, we wanted to see how Americans view a sustainable diet. We found that represents a balanced, nutritious meal was the most agreed upon definition of a sustainable diet, followed by affordable and readily available and having a smaller impact on the environment. Lower income individuals and those with less than college degree were more likely to say that a balanced, nutritious meal was a sustainable diet, while those with higher income and higher education were more likely to say that a sustainable diet had a smaller impact on the environment. So we see there's definitely a divide on some individuals how they define sustainable diet. But perhaps there's also some understanding and agreement that sustainability is a three-legged stool, meaning that it's about environment, economics, and social responsibility. When asked about their perceptions of biotechnology, 2/3 of Americans agree that the overall healthfulness of the food or beverage is more important than the use of biotechnology. And we see that 50% view biotechnology as a tool to have enough food for everyone. Now, when we look at food safety, even though a majority of Americans are confident in the U.S. food supply, we have seen that confidence level slowly eroding from 78% in 2012 to 61% today. And for the first time is that when we ask consumers, what's the most important food safety issue that you and your family have today, chemicals was top of mind. About a third chose chemicals over foodborne illnesses and bacteria, where last year only a quarter of Americans thought of chemicals as a top safety issue when shopping. So we find that those who are not confident in the U.S. food supply are more likely to be concerned about chemicals in food and less concerned about foodborne illness. Conversely, those who cite foodborne illness from bacteria were more confident. And from our previous research, we do see that when consumers state that they're likely to be concerned about chemicals in food, is that they actually might be referring to more artificial ingredients, processed foods, than actual chemicals that we might define as arsenic, mercury, or lead. Over the years, consumers have definitely told us there's so much information out there, they really don't know what to believe. And perhaps who. Over the years, we've definitely asked different trust questions. And this year, we asked, which of these sources would you trust the most to provide accurate information about the types of food and food safety? And we see here that it really comes down to a personal connection. Because in both cases, on what you eat and the safety of your food, your personal health care professional was cited as the one they trusted the most. For the types of food people consume, family and friends was second. However, for food safety, we see that about 4 out of 10 basically do trust the U.S. government agencies for food safety. Interestingly, the two sources that are actually closest to production of food, farmers and food company or manufacturers, are the least likely to be trusted. Perhaps they're the least likely to be known. So regardless of the headlines, we know that Americans are struggling to find consistent, clear guidance to their health and well-being. And even though Americans report avoiding many food components, the overwhelmingly majority want to hear about what they should eat rather than what they should not eat. Americans need positive, actionable guidance to help healthful behaviors rise to the top of their to-do list so that we can promote good advice and overall instill confidence in the food supply. Thank you very much, and I'll turn it back over to Matt.
Okay, thank you, Marianne. And one important word about the survey. The 2015 Food and Health Survey was conducted by Greenwald and Associates of Washington, D.C. It was conducted online between March 13th and March 26th. It includes 1,007 Americans ages 18 to 80, and it's weighted to represent the demographics of the United States. So now we have some time for questions. If you would like to ask a question, you can unmute your line by hitting *6, and then after you've asked your question, and do please state your name and your media outlet, do hit *6 once again to mute your line. So anybody with any questions, please hit *6.
Hello, this is Jackie Dacto with Beef Stuff. Can you hear me?
Yes.
Okay. I was just curious, you mentioned that you asked some information about the dietary guidelines, and you also mentioned that there needs to be more of a focus on what we should eat rather than what we should not. I guess first, did you make any comments with the dietary guidelines with this report? And also, what do you suggest on helping carry that message on what we should eat rather than what we should not?
First of all, thank you for your question, and I would say yes, we did submit comments to the Dietary Guidelines Advisory Committee report. We were probably, I think we were like 27,000, number 27,000 when it comes to the report on Friday. And really we do provide our comments as related to our findings from consumer research. I think as you can see from this year is that overwhelmingly consumers are telling us that they more strongly agree than ever about what they should eat. And I think the reality is that many times headlines definitely are more exciting when we talk about what not to or create some fear. But the reality is that consumers want to have some specific items, what they should eat, giving an overall guidance into based on the My Plate guidance, because in our survey you will see that consumers have recognized the My Plate symbol, and they also say that they are trying to eat more fruits and vegetables. They are trying to consume lower calorie beverages, and they're trying to consume more low-fat dairy items. So of the 10 basic dietary guidelines and guidance that's in the current 2010, we do see that overwhelming consumers are trying to. I just think they definitely need that reinforcement on a continuous basis.
Any other questions?
I'll do a follow-up if there's no other questions.
Go right ahead.
Okay. You mentioned what the slide that you had on who they trust, and you talked about how farmers and food manufacturers are actually at the bottom of that list. You also mentioned that maybe that's because they aren't known. How do we improve that? And maybe also talk, has that been a question that was new this year, or has that gone down or up from previous surveys?
In the trust question, I will say is that we haven't asked this exact question. We've asked a multitude of questions over the years. We had not included farmer previously, so in this food and health survey, even though in some of our other surveys we have. I will tell you about the trust is that last year we looked at we did it in 6 categories, and we looked at physical activity, nutrition, and weight maintenance. And again, the health professional was top of mind. When it came to food ingredients trust, we did see a higher percentage than what's listed here when it came to food manufacturers. And so I think to your question on how do we improve that is that I think many times ag-related organizations as well as companies are definitely putting the face to the face of the farmer or the face of the people that work at a company out there, and that definitely helps because the reality is that people can equate to see that that the food is produced regardless of where it is in the system by humans. You know, I grew up on a farm, so I definitely can appreciate that connection, but we know now that only about 2% of the U.S. population actually have a direct connection to farms, and likewise don't maybe have as close as understanding of how food is produced across the continuum.
Any other questions? A reminder, if you do have a question, hit star 6 to unmute your line. Sounds like somebody is unmuted. Okay, if there are no other questions, we will conclude. Thank you once again, and a reminder that the details of our survey, the 2015 Food and Health Survey, can be found on our website at foodinsight.org. If you have any other questions, our contact information is on the press release, or you can email me at raymond@foodinsight.org. We can also make independent experts available to you to comment on any of the findings in the survey. And also a plug for our social media. Please follow us on Facebook and Twitter at Food Insight. Thanks again for listening, and have a good day.